Good day, I am Jasmine Dudasudanya from BSN 212G, and today I will be performing medical hand washing. So first thing to do is to check the completeness of the supplies to avoid delay or minimize waste of time. So the things that I will be needing are course soap, sink with running water, paper towel, and I have here my trash can, and a lotion. This is only optional, but it is recommended to use after hand washing to keep our hands moisturized. So before we proceed to the actual hand washing, I have to assess my hands first. If I have short nails and no cuticles, because short and natural nails are less likely to harbor microorganisms. So as you can see, I have short and clean nails here. And next, remove all jewelry because microorganisms can lodge in the settings of jewelry. As you can see, I don't have jewelry in me. And lastly, check the hands for breaks in the skin, such as hangnails or cuts, because a nurse who has open sores may require a work assignment with decreased risk for transmission of infectious organisms due to the chance of acquiring or passing on an infection. So we are now ready with the procedure. So first is to stand in front of the sink with the uniform not touching the sink because the sink is considered contaminated. Now we have to turn on the water and adjust its port, making sure not to get the uniform splashed with water. Now we wet the hands from wrist to fingers pointing toward the bottom of the sink. So our goal here is water should flow from the cleaner area toward the more contaminated area. So in this case, the hands is more contaminated than the forearm. So now I have to put liquid in my hands and lather it thoroughly. So in firm rubbing and circular motion, wash hands and wrist for about 15 to 20 seconds. Now I am rubbing palm to palm. So the circular motion creates friction that helps move microorganisms mechanically. Now interlace fingers and rub palm using the back of the hand for at least 5 times each. Next, rub palm to palm with fingers interlaced. Then, rub the back of the fingers of opposing palms with fingers interlocked. And then rub each thumb clasped in opposite hands using rotational movement. Then rotational rubbing backwards and forwards with clasped fingers of right hand to left palms, and then vice versa. And lastly, rub each wrist with opposite hand. Now I have to rinse thoroughly, starting from the most contaminated area to the least contaminated area. Now visually inspect for remaining dirt or soap. Okay. So now I have to dry my hands and wrist by blotting paper towel from fingers to wrist. Now I have to apply lotion if needed. This is to keep my skin soft and prevent chopping microorganisms from faucet handle. Now I'm going to get a paper towel and I'm going to use it to turn off the water, the faucet. Good day, I am Jasmine Medal-Sudanya from BSN 212G, and right now I am going to perform the open gloving return demonstration. So I have already performed hand washing. This is very important in this procedure because this will help prevent infection and avoid pathogenic microorganisms, and also to avoid transmitting them, especially to our patients and clients. And also we have to remember that um, open gloving does not replace hand washing. So I have here my sterile gloves in the size 7. It is important to make sure that we have the right size so that the objects are easy to pick up. And as you can see, it is clean. There are no stains and tears in it. So now I am ready. So I have to remove the outer wrapper of the package and making sure not to contaminate the inner package. Now I have to grasp the inner package and place it on a dry and clean surface, so make sure there are no moisture on the surface that could contaminate the gloves. Now this is the left and the right glove. So since I am right-handed, I am going to put the first glove on my right hand since it is my dominant hand. So now to do this, pick up the glove by touching the inside cuff only. This because hands are not sterile, and by only touching the inside avoids contaminating the outside. So now I have to leave the cuff in place once the unsterile hand releases the glove because attempting to further unfold the cuff is likely to contaminate the glove. So now for the left glove, I have to insert glove fingers under the cuff while holding the glove thumb close to the glove palm so that the glove will not be contaminated. Okay. So now that both of my hands are gloved, we can now adjust. Okay, so once done, interlock fingers of gloved hands and hold away from body above waist level. So this is to prevent the accidental sterile object. So now to dispose the glove, grasp the outside of one cuff and gently pull the glove off. So grasp one side. So I am going to unglove my non-dominant hand first. I have to grasp the outside and turning it inside out. So this is to prevent the contamination of the hand when removing the glove. So now on the hand, I have to take the gloved hand and slide inside fingers and then pull the glove off by turning it inside out over one hand. And then discard in receptacle.